How? Understanding drug therapeutics, pharmacological classifications. Hey everyone! Welcome back to our channel. Today, we're diving into the fascinating world of pharmacology, specifically focusing on how we can determine therapeutic applications for individual drugs based on their pharmacological classifications. So, let's break it down together. First, what do we mean by pharmacological classification? Well, drugs are categorized into different classes based on their mechanisms of action, chemical structures, and therapeutic effects. Understanding these classifications helps healthcare professionals choose the right medication for a patient's specific condition. Now, let's talk about analgesics. These are pain relievers, and they can be classified into non-opioid analgesics, like acetaminophen, and opioid analgesics, like morphine. Non-opioids are often used for mild to moderate pain, while opioids are reserved for more severe pain due to their potential for addiction. Next up, we have antihypertensives, which are used to manage high blood pressure. These drugs can be further divided into several subclasses, such as ACE inhibitors, beta blockers, and diuretics. Each subclass works in a unique way to lower blood pressure, so understanding their mechanisms is crucial for effective treatment. But how do we determine the best drug for a patient? This is where patient-specific information comes into play. Factors like age, weight, existing health conditions, and even genetic factors can influence how a drug works in an individual. For example, let's say we have a patient with high blood pressure who is also diabetic. In this case, a healthcare provider might choose an ACE inhibitor, as it can help manage both conditions by protecting kidney function. Another important aspect is understanding the pharmacokinetics of a drug, which includes how the drug is absorbed, distributed, metabolized, and excreted from the body. This knowledge helps in determining the optimal dosage and frequency of administration. Lastly, each drug class has its own profile of potential side effects. For instance, while corticosteroids are effective anti-inflammatory agents, they can also lead to weight gain and increased blood sugar levels if used long-term. So, determining the therapeutic applications for an individual drug based on its pharmacological classification involves understanding the drug's mechanism of action, its specific uses, the patient's unique profile, and the potential side effects. Now, how to select the optimal drugs for patients based on their unique characteristics. We'll be exploring the importance of binding sites and molecular mechanisms of action, and how these factors influence drug potency, efficacy, and therapeutic outcomes. First off, let's talk about binding sites. Binding sites are specific regions on a target protein, like an enzyme or a receptor, where drugs can attach. Imagine them as a lock and key. The drug is the key, and the binding site is the lock. When the right key fits into the lock, it can trigger a response in the body. Now, why is this important? Different drugs have different affinities for these binding sites, which means they can have varying effects depending on how well they fit. This brings us to the concept of potency. Potency refers to the amount of a drug needed to produce a desired effect. A highly potent drug requires a lower dose to achieve its effect compared to a less potent drug. For example, if drug A is more potent than drug B, you'll need a smaller dose of drug A to achieve the same therapeutic outcome. Next up is efficacy. Efficacy is all about how effective a drug is at producing its maximum possible effect. Even if a drug is highly potent, if it doesn't produce a strong effect, it might not be the best choice for a patient. Let's clarify this with an example. Drug C might be less potent than drug D, meaning you need a higher dose of drug C to see an effect. However, if drug C produces a stronger overall effect when it does work, it might be more efficacious in certain situations. So, how do we choose the right drug? It all comes down to understanding the patient's specific information, including their genetic makeup, existing health conditions, and even lifestyle factors. This is where personalized medicine comes into play. Personalized medicine tailors treatment to the individual characteristics of each patient. For instance, pharmacogenomics, the study of how genes affect a person's response to drugs, can help us determine which medications will work best based on a patient's genetic profile. For example, let's say we have a patient who needs treatment for cystic fibrosis. By analyzing their CFTR gene mutations, we can select a CFTR modulator that specifically targets their mutation type. This means we're not just prescribing a one-size-fits-all medication, we're choosing a drug that's likely to be the most effective for that patient. Finally, let's discuss therapeutic outcomes. This is all about the end results of the treatment. We want to ensure that the drug not only alleviates symptoms but also improves the patient's quality of life. Monitoring the patient's response to the medication is crucial in achieving the best therapeutic outcomes. So, to sum it up, selecting optimal drugs involves understanding binding sites, drug potency, efficacy, and personalizing treatment based on patient-specific information. By doing this, we can significantly enhance therapeutic outcomes and improve patient care. Thanks for joining me on this journey through pharmacological classifications. If you found this video helpful, don't forget to like, subscribe, and hit that notification bell for more insights into the world of pharmacology. See you next time, and remember, knowledge is the best medicine.
Pharmapal.